everyone, welcome back to our channel. I'm Dr Amel from City Skin Clinic, and today I thought we'd have a chat about gummy smile correction or treating a gummy smile. This is one of those treatments that has a functional purpose and is also aesthetic. And in this video I'm going to briefly talk to you about what a gummy smile is, and the causes of a gummy smile, and how you can correct these non-surgically, and when you might need to do something else more involved or seek further advice. Before I get started, if you're new to our channel, welcome. Please subscribe to our channel if you'd like to see more of our content. And if you are a returning viewer, welcome back. So let's get started. What's a gummy smile? Well, a gummy smile is something that's not uncommon. It's when your upper lip recedes, so lifts quite a lot when you smile and exposes the gums. So most people, when we smile, you can see our teeth, and usually you can't see the gums. With a gummy smile, you can see the gums. The extent to which this happens is usually what drives people to asking for help or asking for correction. There's nothing problematic with a gummy smile. There's nothing unhealthy about it. It's just an aesthetic preference, and quite a lot of people with gummy smiles like to have them corrected. And many people who have them aren't bothered, so you're not going to harm yourself if you don't correct the gummy smile. This is mainly for aesthetic reasons that people correct them. And the reason gummy smiles happen is usually, so we have a load of muscles that control mouth closing and opening, and also the muscles that lift up the top lip, so around here. These may be hyperactive in some people, and so when you smile they may lift the lip further up, and that shows the gums, and sometimes it may also make the lip itself appear really thin when you're smiling, so it lifts the upper lip really high, and it kind of recedes and becomes really small and thin. So what can you do if the problem you have is just a gummy smile, and you don't like the appearance of it? Well, a few things. So the most common and most effective non-surgical treatment for a gummy smile is muscle relaxing injections. So in our clinic we use Botox, and these injections are injected where these muscles are located. They don't paralyze the muscles, so not if you do this procedure correctly, but they weaken it a little bit so that when you smile it's not so overactive, and then you are left with a smile that is normal, and your lips cover the teeth when they raise, and they don't show your gums, or show very little of your gums. And it's surprising how well this procedure can work. So there are degrees of gummy smiles. So there are mild to moderate ones where you're just seeing a little bit of the gums, and then there are severe gummy smiles where you're really almost seeing the whole of the gum in the teeth. And even in cases like that, there can be improvement with these injections. So Botox gummy smile injections can work really well for that. They're not instant. So normally it takes about 3 to 10 days to start to see an improvement, and you see the peak effect at the 2-week mark. And in our clinic, with any type of Botox treatment, at that stage we do a follow-up and see whether further top-up of Botox is needed to achieve the perfect result, or if that was achieved in the first time. The effect of Botox injections when treating a gummy smile lasts for about 3 to 4 months on average. Remember, with everything there's always a range. Some people break down the effect of Botox sooner, and so they need a repeat treatment sooner. Other people it lasts longer, but on average it's about 3 to 4 months. And then once the treatment wears off, you're left in the same position. You're not worse off, you're not better off, it just wears off. And then if you like the effect of the treatment, you would repeat it. So it's really simple. There's no downtime. Like I said, it takes about 3 to 10 days to start seeing the effect, and 2 weeks for the maximum effect to be seen. There's always a risk of bruising when you inject someone, but we never really see it in this treatment from all the cases we've done. It's a sort of a quick procedure that you can have at lunchtime, or any time really, and it's really effective, and the results can be really fantastic. We certainly have a really high satisfaction rate with it. And the things to bear in mind with this procedure is It's great. It's best in people who have a symmetrical gummy smile. So in some cases you may have asymmetry, and that gumminess may be worse on one side than the other. You can alter the dosage of the Botox to improve it, but it may not be 100% symmetrical afterwards, and that's something that's worth just bearing in mind. It's also great really for people who just have a gummy smile naturally. There are cases where someone, may have a gummy smile due to other things like scarring from previous procedure or another condition. In that situation, this won't work because we really are looking to correct a gummy smile from muscle hyperactivity. And so what I'm getting at is it's really important to have a discussion and a proper examination to make sure that this is a procedure that will work. But if your gumminess is just naturally caused, then it's a great procedure to consider. Sometimes we see patients with a gummy smile who also have a naturally very, very, very thin lip. And in that situation, again, the Botox will help relax the muscles and prevent the lip from receding upwards and stop the gumminess, but we will combine it also with lip fillers, and that helps just improve the proportion of the lips in a very natural and subtle way, and that gives a really nice outcome, especially for people who may have been very underconfident when smiling due to the gumminess and because they have very thin lips. So they're two good treatments to combine if someone is looking to kind of rejuvenate their smile completely. And the same if you also, in addition to the gumminess, have vertical lip lines or smoker's lines. This can be combined with fillers and Botox in those wrinkle areas to improve the smoker's or vertical lines, enhance the definition of the lip, and also correct the gummy smile. So again, what I'm getting at is when we do treatments, we try not to do anything in isolation. We look at the patient as a whole and we look at your goals. And sometimes that is just a single problem, such as the gummy smile and correcting that. And in some cases, for some patients, it's the gummy smile, but also the appearance or the shape of the lip or any aging around the lip area. So if the problem is a gummy smile in isolation, then we can treat that on its own, or if there are any associated issues or any other aesthetic needs, we can also take care of that using complementary treatments. There are times I mentioned when Botox or non-surgical interventions may not be suitable, and a good example is in someone who has perhaps previously had surgery and scarring in that area. There are situations such as muscle weakening or degenerative diseases where this wouldn't be appropriate, or after Bell's palsy or a stroke, if there is some asymmetry, this treatment could be appropriate. So Botox can be used to balance it in that situation, but obviously you need to examine and look at the underlying medical condition and improve that and optimize it before you have these treatments. And that's something that we discuss with patients if they have a more complex medical history. Finally, one of the other treatments that has been traditionally used for gummy smile correction is surgery. So in patients where non-surgical interventions may not work, there are surgical procedures that will cut that muscle or reduce its activity. That sort of procedure is incredibly less common at the moment because of better non-surgical interventions. But again, we and all reputable clinics and doctors will discuss these options and let you know what you would get the best out of. Anyway, I hope you enjoyed this little introduction to gummy smile correction. It really is a fantastic treatment. It's very fuss-free, so it's in line with our ethos, and that's why we like it. I've left some links below to our gummy smile correction page and information pages. If you have any questions, please leave a comment below. And if you like this video, please give it a thumbs up. Until next time, stay beautiful.